Hey, future nurses, are you stressed about getting your license? Here at Remar Review, we believe in faith over fear. I'm Regina Callion, the #1 NCLEX instructor in the world. Tune in to Remar Nurse Radio on Spotify and Apple Podcasts for new episodes every Thursday. We got that exclusive content. You don't want to miss it. We can, we will, we must pass NCLEX. Hey everybody, it's time for Monday Motivation. Let's talk NCLEX. This is my favorite time of the week where I get to spend it with you all, and we get to do Let's Talk NCLEX Monday Motivation. Hey, today we are talking about nursing assessments. That is our priority for today. So you will enjoy this Monday Motivation, I promise you. If it's your first time here, hello, my name is Regina Callion, and I am here with Remar Review, a company who loves to help nursing students at whatever point you are, if you have graduated, for you. And so I like to call myself the #1 NCLEX instructor on this planet, here with your inspiration, motivation, encouragement, whatever it is you need. No excuses, no excuses. This is No Excuses Monday. And I'm very excited to bring our topic for Monday Motivation. It's so relevant to me, where I am, my journey, and hopefully you as well. Let me show you the topic. The topic is live in the present. Live in the present. Man, oh man, is that so important. That is, it's one of those concepts that you have to grasp if you're going to enjoy life. Whether you're a nurse or not, living in the present will help you to have the mentality where it's like, hey, I'm on a road, I'm on a journey, but I'm also going to enjoy that journey, and I'm not going to miss the journey, because the journey is part of the growth and experience. Did you catch yesterday? Did you guys catch yesterday? We had an amazing event. We did another RNU where I got to meet you all. I got to bring out Team Remar to represent. We had RNU in Youngstown, Ohio, and it was so wonderful. It was so wonderful. We talked about T's. We talked about HESI. Check it out. It's a little bit of the class there that we had, and just good. So it was me, it was nursing students from all over, and we really just got to have a great time. I also gave a code out for the Ultimate NCLEX Success Program. Gave it out yesterday, but you know what? That code is still available right now. It's RNU for $50 off of the Ultimate NCLEX Success Package. And you know, one of the things that I really like about being able to meet and talk to nursing students is to hear their stories. And there were nursing students there who had gotten into nursing school, but for some unfortunate circumstances got kicked out or had to leave nursing school. And so now they're on the process of reapplying to get back in. And you know what they have to take? They have to take their T's again. You have to take that entrance exam. So yesterday was our first time where we had the quick facts for T's, HESI, and nursing entrance exams available for those pre-nursing students. So if you have a nursing student in your life, or somebody that you know is wanting to be just like you, wanting to be a nurse, this is a gift you can give them. Christmas is coming. So I need you to put this on the list, because the nursing students were so happy to get this quick facts for T's and HESI. And this is the entrance exam. So it is just like this book is just like its big sister, Quick Facts for NCLEX. So when you open it up, you're going to have your 3-week study calendar. And these are all of the topics that are on the nursing entrance exams. So you have mathematics, you have science, you have anatomy, even nursing students. You guys know we need to brush up on that anatomy, right? So nursing students who are interested in getting into a great program and getting high scores on their HESI entrance or TEAS entrance exam. Quick facts. All right. Also, another thing, let me just grab it. Another thing that I was able to debut was this beauty right here. This is First Shift. And people ask me all the time, Regina, I want you to mentor me. I want to be what you are. I want to do what you're doing. This is the perfect way to get all of my tips, tricks, ideas that I developed personally while I was a nurse working all over the country. You guys know I did travel nursing. I did cardiac nursing. So I picked up a lot of things that helped me dominate my nursing career. So I titled this book First Shift, and underneath I have Dominate Your First 2 Years of Nursing, because I honestly think the foundation and the mindset that you have in the beginning of your nursing career will totally change how you go through that experience. And you see nurses that are doing like amazing, like they are doing it in nursing for sure. They didn't just start that way. You know, they had to go through some things in order to get through it. And then you see other nurses who are in the field and they are miserable, they're unhappy, they have a ton of knowledge and experience, but they just have not applied it to their own personal life. So they get in a rut with nursing. I don't want that for you guys. I don't want you to have the rut. I want you to have the focus, especially when you're a new nurse, so you avoid some of the pitfalls that I myself even experience, or that I see other nursing students experiencing when they become nurses. So after NCLEX, First Shift. Before your first shift, First Shift. And I like this book because I really do. I talk about, what to put on your cover letter when you're a new nurse, how to make your resume look great when you don't have that clinical experience, right? What to expect at the job interviews, how to answer those difficult questions. Also, we talk about in First Shift, just how to relate to your colleagues, what things not to do, how to dominate your patient assignment, no matter what it is. And there was actually how to give a good report. You guys know one of my most popular videos on YouTube is how to give a good report. So I talk about that in the report form. Like I literally list out things that I would put in my report form to say. So inside of this book is really cool. Another thing that I like, is that a picture of myself? Yeah, there's a picture of me as when I was a new nurse. Also how I managed my day. I used something called an hourly task manager. And so literally I would write down the things that I would have to do. So I just wrote like how to organize your shift, how to, relate to your patient so that you're not wasting time as a new nurse. So very beneficial. Christmas is coming. I'm just putting this out there. This is the gift that you want to get to yourself. So all of those things are happening for us. And Remar, we're just at a place where we are growing so much because of you guys. We are growing so much. Somebody say, yes, I want to be a confident. Yeah, you want to be a confident nurse. Exactly. Oh, so the price for this, but I didn't even give you guys the price. Oh my goodness. So for the quick facts right now, if you go to remarnurse.com right now, $20 for this book. Okay. Only $20 for this book. And for First Shift, there's some variations of it because you can get this book signed by me. You can just get it as it is. So get it signed by me because I'll write a little note in there for you and sign it. But if you just want this book, it starts off at $20 as well. So reasonable for information, because literally this is 2 years of knowledge. This is like if you didn't have me as a preceptor, but you wanted me as a preceptor, these are the things that I would tell you. And I talk about my preceptor. And you guys know when I was a new nurse, my first preceptor she was something else. And so I share that experience with you guys and things that I learned from it. So super excited. Yeah, super excited. And I just hope you guys love the book. Like, that's just what I want. It's really like different because it's not like an NCLEX product, but it's literally my own personal experience in life. So I am super invested in our motivational topic for today. And I have 200 Remar nurses. The topic again, guys, is living in the present. Living in the present. So here's the devotional that I just want to read. It says this: all you need is within you now. All you need is in this very moment right now. This precious present moment, to be aware of all the miracles that are around you. Unhappiness is formed when we take our minds away from the present moment. Stress, disappointment, and anger when we think about events of our past that we have no control over right now. Anxiety or worry when we think about the future, also of which we have no control over right now. So appreciating the wonder and miracles in each moment. You need nothing materially speaking. You are complete as you are right now. So this is such a powerful thought, living in the present, living in the moment right now. Some people literally, they live their life based on, what is the next thing I have to do? Okay, what is the next thing I have to do? Are you like that? Are you like, even now when you wake up in the morning, you're like, okay, I have to get to work. So you have to get up and you have to rush. And then when you get to work, you're at work, but then you're thinking, okay, what do I have to get done? And then what am I going to have for lunch? And then I got to pick my kids up at 5 o'clock. And it's literally still 9 a.m. You just got to the next place. And so for some of us, the present doesn't even exist because we are so focused on worrying about either what happened in the future or what's going to happen in the future, or we're thinking about the past. We wake up in the morning and the first thought we have is, oh, I lost a job, or, oh, my relationship is failing, or some people is, oh, my mom passed away, or my husband left, or, my kid got kicked out of school last week. So we're living in the past or the present. I mean, we're living in the past or the future. So the present doesn't even exist, but that is all that we have. All we have is today. All we have is right now. So we have to stop trying to access the future or the past and really enjoy today, enjoy right now. All of the decisions that you ever are going to make, guess what? You can only make them right now. Even when we think about, oh, how good it's going to be in the future, how great it's going to be when we pass NCLEX. Yeah, that thought is good, but we don't have access to that time. We don't have the happiness of that time. What we have is, what am I going to do right now today to get me there? Because we want to get there. We want to get to that place where we don't have tests, we don't have all these things, but that destination is not more important than you right now, because it's what you're doing right now that will ultimately get you to that place. I spoke yesterday and I was a little bit nervous, and usually I don't get nervous when I speak. I speak all the time, but I was a little bit nervous, and I was like, I was just in prayer, like, Lord, help me not to be nervous. Help me not to be afraid. And it was just like, okay, what are you afraid of? What are you nervous about? Right now, everything is good. Everything is fine. So by me anticipating the future, right? That's when I became full of anxiety. instead of literally just living right now in the moment where I had no worries. Everything was fine. And so I tried to live moment by moment by moment. And I ended up having a great time. It was like no worries, no fears, no anything. And I just wanted us to keep that same thought, keep that same energy for today. The destination is great, but it's really right now enjoying this moment that you have, because you may not have the future and you certainly don't have the past at all, but what you have is today. So let's enjoy it. So there are some ways that I thought, how can we live in the present? How can we enjoy where we are right now? And I want to share them with you. Let me show you. So the first thing is limit technology. Oh, and this is such a hard one. Monday motivation right here, limiting technology, because actually when you are on the phone, when you are checking your emails or you're taking photos, oh my goodness, you are not in the moment. You're really in a perpetual cycle of trying to do something for the future. Like, has this ever happened to you? Like you're out with your family and your kid is doing something really cute and you're like trying to get a picture of it. So you're like, oh no, be still, do it again. Smile this way. Look at mommy. I have to admit that's me. Like, look at mommy. And I'm taking the picture over and over again. And what happens is I'm trying to capture this moment so much for the future, for like a video in the future, that I lose out on the opportunity to just enjoy it, to just enjoy the moment. So for me, even when we were having dinner with Nurse Velma last night, Mark and I took a student to dinner that came to RNU. I did a short Facebook video, but then I literally just like put my phone down because I wanted to be in the moment. Right. So I know I'm talking to somebody today. Somebody is relating to me. So let's limit our technology. The second, I really think is very important. It's difficult to do, but it is to forgive quickly. You have to be able to forgive people almost immediately, because the idea is if you don't forgive them, then you have the burden of carrying around that past offense, right? You have the responsibility to keep that anger, keep that offense going, because when you forgive somebody, you're not forgiving them for them, you're actually forgiving them for yourself, because what you can do is say, you know what, anymore. I don't have to have any hostility towards you. I don't have to be offended. I am free from that interaction. And, whether the person accepts your forgiveness or ever speaks to you again or anything like that, it doesn't matter, because you've forgiven them. So you're able to let go of the past. You don't have to anticipate, negative things in the future. It's over. It's done. And that allows you to just enjoy today. So forgive quickly is my second one. And then my last one is, honestly, it's a mindset. It's just take control. You are, no matter what it seems like, you are in control of your present. Now, we can't control what happens, but we can certainly control our reactions to everything. So I need you to just own it. Own your existence, own your time, own it, okay? And some people may feel like this time for me is so unenjoyable because I haven't passed NCLEX. And I'm just studying and I don't like studying, so it's not enjoyable. But you have to find a way to enjoy your life, even when you're going through struggles and trials, even when negative things happen to you. What do you need to focus on? Because our brains are going to try to, draw us to the negative. It's easy to look at the negative. It's difficult to look at the positive, but the positive for everyone is that in most cases, the struggles are just temporary. In most cases, the struggle is something that you probably in your past have already overcome something greater. Like when nursing students come to me and they say, oh, this NCLEX is so tough. It's such a struggle. And then they tell me all the things they've been through in their past. grown up with, single parents or in abusive relationships that they've come out of, or been homeless that they've come out of. And I'm thinking to myself, you guys out there, you're heroes already. You've overcome things way more challenging than NCLEX. Just getting into nursing school, getting out of nursing school with these instructors, as some people said, they literally, nursing school is such a challenge for them because the instructors seem like they don't want to be there. So NCLEX is light. NCLEX is easy compared to what you guys been through. So keep that positive attitude, keep that positive energy, and let's live in the present for this week. Can we agree to do that? I liked this image that I saw, and it said, not yesterday, not tomorrow, now. Not yesterday, nope, not tomorrow, now. And I just wanted to put that up because it was so relevant, man. All right, so we are going to transition. I hope you guys enjoyed Motivational Monday. That motivation is, hey, let me, you guys maybe not got a chance to see RNU yesterday, but hey, it is on YouTube right now. That's right. If you didn't get a chance to see RNU yesterday, where we went over the anatomy, we went over the NCLEX questions, check it out right now because it is on that YouTube. What do we got here? I got a letter, and it says, Nurse Pilar passed NCLEX after 26 years out of school. Congratulations. That is the Monday motivation right there. All right. 26 years out of school. Are you still on here? If you're still on, let me know. Did you pass NCLEX RN or PN? Team Remar shouted you out. They said you passed NCLEX after 26 years out of school. Amazing, amazing, amazing. All right. So we're going to get started right now with our topic for NCLEX is assessments. I really wanted us to be able to focus on if we're picking the right assessments. Okay, the right assessment findings. So here we go. A nurse is caring for a client with recent liver transplant. The client has become unstable and breathing has stopped. The nurse is unable to find a pulse and emergency interventions are necessary. Which task is most appropriate to delegate to the UAP? All right. So do we know the situation? We got to know the situation and let's go. Here we go. The choices are, what do we have the UAP do? Is it number 1, give rescue breaths during cardiopulmonary resuscitation? 2, assist with oral intubation? 3, administer epinephrine IM? 4, place the transcutaneous pacing pads? Or 5, position the client with the head elevated? Oh, here we go. I need you guys to pick the right answer. And this is really assessment. What are we going to have that UAP do? Oh my goodness. Okay. All right. I see the answers coming in. Good job, YouTube. Good job. Okay. Hi, Alcine. Alcine's like, it's me. I'm using my husband's computer. That's cool. I'm just glad you're here. Shout out to the registered nurses that are watching, already past NCLEX, but keep coming back to learn new things. That is phenomenal. Get first shift. New nurses, get first shift. All right. So I see the answers coming in. A lot of 5s. A lot of 5s on Facebook. A lot of 1s on YouTube. What is the correct answer? What is the correct answer? The correct answer, you got it right. You got it right. It is, Myrna, good job. The correct answer is actually number 1, okay? Give rescue breaths during cardiopulmonary resuscitation. We can absolutely have the unlicensed assistive personnel do CPR. Remember, the unlicensed assistive personnel is trained in basic life support. They are able to give rescue breaths and do chest compressions. The nurse should perform all other tasks. All right. So when you're talking about what the aid can do, let me go back. Okay, so these were the choices. Oh, here's the right answer. These were the choices. Set to assist with oral intubation, not going to have the UAP do that. Of course, they're not going to do number 3, administer epinephrine IM, not going to happen for the aid. And then placing the transcutaneous pacing pads, that's also not going to be appropriate. Okay. And then a lot of people did pick number 5, position the client with the head elevated. All right. So the reason why this is not going to be appropriate, is because remember in the question, it said that the patient, they became unstable and breathing has stopped. So this patient is going to need some sort of manual resuscitation, perhaps CPR. The nurse is unable to find a pulse, and we cannot have the patient in what position? Okay, with the head elevated. All right, we're not going to do that. So reading again here, we've been focusing a lot on just reading the question and making sure that we understand what we're being asked and what needs to be done. Are we all clear on this one? Are all minds clear about how the UAP is able to do that CPR? Got it? Okay. Yeah, you guys did. Some people, they're really good. Some people didn't get it right, but hopefully you understand now why the answer is the right answer. That's what's important. These questions are tricky on NCLEX, and that's why I bring them to you on Monday so that you're able to critically think no matter what the scenario is. All right, let's do another question here. It says, okay. Oh, so if you saw, okay, this is a repeat question, but it's really good yesterday, and a lot of the students in the RNU class did not get it right. So I'm bringing it to you guys again. The nurse is caring for a client who has a history of CHF. Upon assessment, the client states that he has severe pain when he breathes in and out. Which is the most appropriate action by the nurse? Is it number 1, instruct the client to take slow, deep breaths in and out? 2, give the client a pillow for splinting during inspiration and expiration. 3, administer oxygen 2 liters via nasal cannula. Or 4, administer prescribed IV pain medication. Let's go, Remar nurses. Let's go, Remar nurses. All right. If you attended the class yesterday, don't cheat. Don't tell them the answer. All right. But what do you guys think? The situation is that the patient has, what do they have? They're having trouble breathing out because of what? All right. So I see the answers rolling. Keep them rolling. Go ahead and answer and then share this video. The correct answer, guys, is going to be you have to administer IV pain medication, because what is the client complaining of? They're saying it's the pain. It is the pain that will cause them not to be able to do appropriate ventilations or respirations or breathing. So all of the other choices there still leave your client with that pain. Do you guys see that? So if you pick number 1, where we are instructing the client to take slow, deep breaths in and out, well, yes, we could do that. But what are they going to say? They're going to say, I can't breathe because I'm in pain. So it doesn't matter if the breathing is slow or fast, it still hurts. And then the second option was give the client a pillow. I didn't see too many people pick that, but the pillow is great. Patient says, I'm in severe pain. We give them a pillow and say, use this, to help you breathe. The pillow's not going to be effective for that patient. And then the third was put oxygen on the patient. Well, that may improve the oxygenation a little bit, but if the patient can't take that deep breath in, then it's not going to be very effective. All right. So the oxygen is just going to stay it's just going to stay up here, right? It's not going to get down. It's not going to get down into the lungs. So the correct answer was administer prescribed IV pain medication. All right. We've been together for almost an hour. 12:39. All right, let's keep going here. I got another question. Oh, and this is a good one. I'm switching it up on you guys. We're moving to psych. So join me on psych now. Here we go. A nurse is caring for a manic client. Which activity should the client be assigned? A nurse is caring for a manic client. Which activity should the client be assigned? Number 1, playing one-to-one tennis with a peer. 2, group mini golf for 30 minutes. 3, natural painting class in a community class. Or 4, running on a treadmill as tolerated daily. Oh, this is a good one. It's critical thinking. I wrote it just for you. I know you're going to love it. I know you're going to love when I give you the answer. This is testing your critical thinking, REMAR nurses. I appreciate you taking your time out to study with me today. I want you to leave feeling like you learned something. So I see the answers rolling in, and I have, okay, Facebook. All right. So a lot of you guys are picking 4. Okay. I see you. And on YouTube, we have a lot of 3s, and we have a lot of 3s on YouTube, 3s and 4s on Facebook. Okay. Correct answer. Everybody got a chance to read this through? I see you, Bethany, you 3 and Nina 4. Okay. So the correct answer actually, and when I post the right answer, I want everybody to think about why it's the right answer. All right. And why the other ones won't work. So I'm actually going to tell you the answer before I show you. So the correct answer is number 4. All right. The correct answer is number 4 here. Why is number 4 the best answer? Why is it the best answer? Look at the choices again. Why is number 4 the best answer? I want somebody to put it up on the screen. Write it in. The correct answer is number 4, but tell me why. All right. It is because what? Some people are still posting numbers. Okay. So the reason why, so the reason why is because the other activities are group activities, or yes, Nina, they're group activities, or they're competitive activities. And for our manic clients, we cannot have them. They need to be on their own. Exactly, Keisha. They're alone. So can you imagine, a manic client in a community class painting? They're going to be very disruptive to that class, right? Or even mini golf with a group. They're going to be very disruptive. So they're allowed to, or they should be allowed to just run on a treadmill. You're alone. Go ahead and get that energy out. Yes, he's doing it by himself. Correct, right? So we see it now why this is the best answer for manic clients. Manic clients, no group counseling, no group anything for your NCLEX exam. You're going to thank me. You're going to thank me when you see that. All right. So 4, here we go. 4. And I'm not going to keep you guys long today. Here we go. The registered nurse is working on a progressive care unit with an aide. Oh, so good. Which client should be assisted by the registered nurse? Number 1, the client with type 2 diabetes headed to the vending machines for a snack. 2, the client who is reporting a headache. 3, the client ordered to be NPO requesting a drink. Or 4, the client with tuberculosis who wants to leave the room. So good. This is assessment. This is critical thinking. This is who should the registered nurse see first? Who should the registered nurse see first? Oh, this is good. I'm so glad we got over, oh my goodness, we got hundreds of nurses. That's all I'm going to say. We got hundreds of nurses between YouTube and Facebook studying with us on this Monday. Where does this happen? Nowhere but Remar Review. Thank you guys so much for being faithful family members here. But I'm looking for the correct answer. Which client should the registered nurse see first? All right. Hey, I hope that today you got at least 2 of the answers right. These questions were hard. So if you got 2 correct, I would say you're doing pretty good. All right. I would say you're doing pretty good. So a lot of 4s and a lot of 2s coming in here. The correct answer, this is an assessment and almost a priority question. I could have wrote this as a priority question, but I went for the assisted delegation / assessment question. So the correct answer is going to be, yeah, you guessed it. Number 2, the client who is reporting a headache needs to be evaluated. This patient needs to be assessed by the nurse. What do the other clients need? All of the other clients just need to be told no, right? Really, that's really what it is. Can we have the aide do that? For client number 1, type 2 diabetic, headed to the vending machine for a snack. The aide can say, you know, Mr. Johnson, you're on a diabetic diet. You really should not go to the vending machine. Okay, I need you to go back to your room. 3, the client ordered to be NPO. NPO sign out on the door. The aide can say, no, you can't have a drink. You're NPO. The doctor say you're NPO, right? Am I right? The aide can do these things, right? And then 4, what was it? The patient with tuberculosis want to leave the room. We can have the aide go there, tell Mr. Brown, no, Mr. Brown, you cannot leave the room right now. You have to stay in your room, okay? But this new patient that's reporting a headache, what can the aide do for that patient? What can the aide do? We need to have the registered nurse in there to assess this client. So 2 is going to be the correct answer. All right. Does that make sense? Reporting a headache? Okay. All right. Right. Remember, write this stuff down. If you didn't get it right, then you know what kind of questions you need to focus on. So let's go to question number 5. A nurse is assisting a client instill a nasogastric tube. Which of the following interventions will be most effective when the client complains of choking on the tube? All right. So we have number 1, placing the client in a head to the side position to facilitate the position of the tube, ordering a guided x-ray to facilitate the positioning of the tube, massaging the throat while placing the tube, or 4, offering the client ice chips while the nurse advances the tube. Offering the client ice chips while the nurse advances the tube. Which one is going to be most effective? And I'm going to give you guys a second to think about it. I'm going to try to do something. I don't know if this will actually work for me, because I've never done it before, but I'm just going to. All right. So I think I have. Do you guys know the answer? What I'm trying to do is put the answer on here because it wasn't on here. So I got to put it on here for you guys. And I think I did it. So do you guys have the answer for if we are assisting a client who's having a difficult time, they're having a difficult time getting their NG tube down, what do you guys think the answer is? A lot of people are picking 4. Okay. 4, 3. So the choices were placing the client's head in a head to side position. We do that. Ordering a guided x-ray to help you get that NG tube down. Three, I think it was between 3 and 4. Massaging the throat while you're trying to put the NG tube down. Or 4 was give the client ice chips while you're trying to put the NG tube down. What do you guys think it is? All right. And good afternoon, Remar family. This actually is our last question. If you're just coming, you're a little bit late. The correct answer is going to be number 4. We want to offer the client ice chips while the nurse advances the tube. And, the purpose is that when you give ice chips or even sips of water, it helps the patient to swallow, which will help them not to choke on the tube, but it'll allow you to guide the tube down while they're eating ice or swallowing. So look that up. Yes, ice chips do melt and turn to water, which helps the patient to swallow. It's not easy putting down an NG tube, but there are little things that will make it more tolerable for your patient. Okay, our NCLEX questions, they spanned a whole different topic. So we went from assessment to psych, back to assessment, and then we followed it up with skills. So it was definitely a power study session. And I wanted you guys to kind of feel like this is how NCLEX can be, because it is. You're going to get questions from all over the test plan. So you got to be ready for it. So I hope you enjoyed studying with me today. Also, don't forget, this is the RNU code for our event that we had yesterday. It is RNU, and that's $50 off of that success package. Comes with the 4 DVDs. People ask me all the time, what does the ultimate success package come with? It comes with everything. It comes with the 4 DVDs, quick facts for NCLEX. You get the quick facts DVD, you get the 4 books, and you get the question bank book as well, all for the ultimate NCLEX success package. But if you still have questions about, what you need to do, what you need to study, if you have a prayer request as well, any kind of concerns, that email support@remarreview.com, support@remarreview.com. And I love leaving classes and our Monday motivation, Let's Talk NCLEX, or Winning Wednesdays, everything that we do here for you guys for free, RNU, with our saying. And this is, something that we love to say around these parts. It is, we can, we will, and we must pass NCLEX. Wow. So thank you guys for your time. Don't forget, we have 2 new products that I want to tell you about really quickly. One more time. This is First Shift. I saw people ordering it online as we speak today. And this is how to dominate your first 2 years in nursing school. And then we just have our book here. This is Quick Facts for TEAS or HESI or any other nurse entrance exam. And we just have the book right now available. So it will definitely help. I saw the TEAS books that are available, and they are like 6 times bigger than this. So we pack the information into this quick fact. So I hope you enjoy it, and I hope you can get it for somebody that's interested in nursing. Mentor them, get them in the profession. Remember, we have a responsibility to get somebody into nursing because there is a shortage. So remarnurse.com is where you can get those products. I hope I will see you guys next Monday for our next episode of Monday Motivation. Remember this week to live in the present, live right now in the moment. See you guys later. Bye.